But once again, good morning, good afternoon, good evening, wherever you're joining us from. My name is Lawrence Clausen. I'm the Senior Associate for KM and Communications with the Data.FI project. I'm so thrilled for you to be joining us today for this webinar on health information system strengthening, particularly looking at the Central American experience. We have some really excellent presenters today that we're lucky to have, so we'll be getting right into that in just a second. All I will say at the outset is just some basic housekeeping. We will be having a Q&A session at the end where you can ask as many questions as you would like. But if you have any questions throughout, please feel free to put them in the chat as well. We welcome that. And maybe we can answer those. Our presenters can answer them as the webinar is going on, just in the chat function. And again, just sort of feel free to pose any comments. We really welcome all the discussion we can get. And without further ado, next slide, please, Eric, so I can briefly introduce our speakers. So as I said, we're really lucky with the panel we have here today. I'll let them say a little bit about themselves as well when they get started. But our first speaker is Eric Ramirez, who's the Senior Technical Advisor and Information Security Brain Trust for the Data.FI project. Then we also will be hearing from Kristina Mwanza, who is our Senior Technical Advisor specializing in data use. And last but certainly not least, we have Otto Letona Guinea, who is our Senior Health Information Systems Advisor, and he is based in Guatemala. And all three of our speakers have been working in this area for many years, and in particular have deep experience working with government stakeholders and also non-governmental stakeholders in health information system strengthening. So as I said, we're lucky to have them. And without any further ado, over to you, Eric.
Thank you, Lawrence. Good morning, everyone. Can you guys hear me okay?
Yeah, we can hear you great, Eric.
Yep.
Thank you.
Perfect. Thank you. Yeah, thank you, everyone, for joining us this morning, this afternoon, this evening. We realize everyone is busy these days, and we really certainly appreciate you taking an hour of your time to listen to the experience that we have to share with you. So as you saw the title of the presentation, today we're here to discuss a little bit about the work that we have been doing in Central America. We are going to briefly touch upon how our project Data.FI is doing health information and strengthening in these Central American countries. Also, we are going to share with you a little bit of what makes the context in Central America a bit different from other regions of the world. We are also going to share with you how we have found a way to combine health information systems and data use approaches into our overall strengthening practice. And lastly, we are going to share a few examples of the results and the exercises we have completed in these countries. So just to dive right into it and to share a little bit about our project, Data for Implementation, or Data.FI. It's a US-funded project that started in 2019 and is funded through the end of 2025. We are PEPFAR funded, so it is an emphasis on HIV programming. And as you can see in this image, we have a very strong presence in African countries. And we also have 4 Central American countries and Jamaica and the Latin American region. As I mentioned, it's mostly HIV programming, but we also did receive funding during the COVID pandemic. So all of the practices that we are going to share today have also been used to support COVID programming. And as of late, we have also received funding for health security in Tanzania and in Guatemala. One thing that I want to stress is that the practices that we are going to share today obviously have been put to use for HIV programming, but they're generic enough that you can apply them in any other program or health program that you want to support. So that's what we are, Data.FI, in over 20 countries thus far, and that's what we are doing in this region. In terms of what we are offering to the countries, our value proposition revolves around 4 pillars. As you can see at the center of this circle, We do data use, analytics, data sources, and optimization of health information systems. So those four elements that you see at the center, we can condense them in two big pillars that are data use strengthening and health information strengthening. And those are the two areas that we are going to discuss today. So when we talk about data use strengthening, we are referring to all the practices and methodologies we use to support countries so that they can accelerate the ways in which they put the information they have to use to support decision making using analytics and reports and visuals, but also building accountability across the stakeholders so that they can measure the indicators that they have chosen. And then for the lower part, when we talk about health information strengthening, we are talking about the practices that helps us strengthen the data sources, meaning whatever form the information is available right now. It could be paper form, it could be an information system, it could be a database or an Excel spreadsheet. So how we improve those data sources and the procedures and the flows of information they make that information available for analysis, and how do we make those solutions scalable, and how we optimize them so that investment can may give countries the highest return possible. So that is our goal as a project. That is our value proposition that we offer to the countries where we are operating. And to go to focus more on the area that we are discussing this morning, the Central American region. There are, as I mentioned, 4 countries in the region where we are currently in operation. Those are the green countries that you see in this image. As you can see, there's a fairly large number of people living in the region. The people living with HIV is comparatively not as high as other countries you would see in other regions, as well as the number of people, the number of deaths that are HIV related, as you can see, are also lower than the ones you would see in other regions. So that is part of the context that we are under which we are working in Central America. Another thing that is important to note, and it's probably one of the most relevant right nowadays, is that you probably have heard about the influx of migration coming from the Northern Triangle, which are the countries closer to Mexico and Central America. And the US is providing funding to support governments in those countries to improve conditions for social stability, education, and health. And so funding is going towards those kinds of programmings, including the things that we are doing in country, so that we can improve the conditions on the ground and try to reduce irregular migration towards the US. So that is part of the reason why we are being asked to support these countries, and we are making everything we can to improve the conditions on the ground so that people don't have to migrate. Okay, so in terms of how we do the work that we do, I would like to start by saying that we look at the projects in each country as a sequence of steps. The first one being, we have to obviously set up the project, understand what is the need, understand who are the stakeholders, what's already there, how do we fit into it, and then put all of that into a work plan in coordination with the local authorities and USAID, our funder. And we do that so that the project is not isolated and that the scope can be not as effective as possible, and the resources are enough for the outcomes that we want to see. So that's the first step. And once the project gets set up, the next stage is to define, in collaboration with the authorities, to define what are the priority outcomes or health outcomes that the local authorities want to invest on. And so to do that, we develop a logging framework through which priority indicators are identified, and we also identify reporting needs, and all of that is handed over to a technical working group or a data review committee that is charged with moving all of those products along. And this step is important because it helps us align stakeholders, making sure that the priorities are clear, the objectives do not change within the span of the project, and that there's alignment, as I mentioned, across the stakeholders. And having those needs identified, the third stage is to move into the implementation, the how. And this stage, we look at the information flows that are already in place, the organizational structures, the functions, the roles, and also the information systems, the software solutions that are already running and managing the information. And the goal of doing this is that we, aside from obviously building resilient technology solutions, we also want to help authorities eliminate redundant tasks, improve their processes, their information flows, and their management structures so that they get rid of duplicative tasks, and as I mentioned, redundant tasks, and at the end, we can write up a system that produces more reliable, complete data. And so to go even further down into how we do this, there's a path that you see on this slide that is divided into two main pillars that I mentioned in 2 slides ago, or 3 slides ago, excuse me, regarding data use and information systems strengthening. And the upper level of this slide in colors blue-ish, you will see the data use path of swim lane. And the bottom part color purple, you will see the information system activities or practice. And you will notice that both start with the definition of the priorities. As I mentioned, Data.FI, it's a project that is working to improve health outcomes. So we start by asking ourselves and asking the local authorities, what are the health outcomes that we want to improve? Where should this effort be focusing on? And so once we define those priority indicators, we start on the data use side, we start defining those reference sheets for the indicators that were prioritized. We start iteratively designing mock-up dashboards so that the authorities can in collaboration with the different implementing partners and other organizations, they can start reviewing the indicators and improving those dashboards so that they can make informed decisions and take actions through data review meetings, and eventually assess that progress and communicate that progress through a data use brief. So that is the work that is carried out through the life of the project by the data review committees. In some places, they're called situation rooms or epidemiological control rooms. They have different names, but it's basically the same concept. So that's on the data use side of things. And then for the information systems side of the equation, you go after the definition of priority indicators, we started looking at how information is handled from the point it is collected at the service sites all the way to how it's analyzed at the central level using dashboards or any tools that they may have, ensuring that those processes are documented, that there's agreement on how the processes are completed across different sites with different regions. Besides documenting those processes, we also look at the information systems that are in place. And out of that analysis, we come up with recommendations and priority actions that need to be addressed by the authorities. And we obviously offer support to implement those recommendations and to improve the systems that they have, and ensuring that we build capacity and we are able to hand over to the local authorities. As you can see on the information systems side, there's also work that has to do with coordination. We're looking at information flows. There's different implementing partners involved. There's different actors from civil society or the private sector. So you definitely need to do convene all these actors to build alignment and to build agreement about how things are going to be improved. And that is why we create a technical working group to discuss all these ideas and to move things forward. So that's just a quick run of what we do. For the remainder of the presentation, my colleague Jenny Mwanza and Otto Letona are going to go over a deep dive of each one of these sections. And so I'm going to hand it over to my colleague Jenny Mwanza to walk us through the data use portion of it. Over to you, Jenny.
Super, thank you, Eric. And good morning, good afternoon, good evening, everyone. Thank you for joining. My name is Jenny Mwanza, and I'm a senior technical advisor with Data.FI. And the work that I lead is promoting data use for improved health outcomes. And today we'll be looking at how our data use work really also informs our information system strengthening work. So working hand in hand across Central America. Next slide, please. To share a little bit about the context, when we first began working in the 4 countries across Central America, Guatemala, Honduras, El Salvador, and Panama, we find a situation in which ministries of health are collecting and collating a range of data for essentially their own use, but also for reporting to different donors. In some countries, when we first conduct this inventory, we found that ministries of health and national HIV programs were aiming to collect and manage close to 100 different indicators, each with their own different disaggregations. So in this situation, when we begin compiling all of these indicators, we end up really with a maximum data set. And these data reported on different intervals. Some might be monthly, others quarterly, others not reported to the government until the end of the year on an annual basis. So the multiplicity of systems really results in a situation where government leadership and national HIV programs across Central America have had a difficult time seeing their whole performance across the prevention and treatment cascades. So our approach really for launching health information system strengthening work is to sit with the stakeholders in the government and to analyze these different reporting requirements and to coincide them with UNAIDS guidance, as well as their own national priorities and their health strategic plans. So our overarching goal in this process is to ensure that any investments in information systems are really serving policy prerogatives and priorities and the needs for decision makers to allocate resources to accelerate their work across the HIV prevention and treatment cascades. Next slide, please. And so here we have a couple screenshots just to demonstrate our process, certainly working against global guidance and really looking to partner with the government to find some harmony and some agreement across different reporting requirements. Oftentimes governments are receiving funding not only from PEPFAR, but also Global Fund and other groups. And really just we're asking basic questions across the HIV treatment cascade, and really working with the government to assume their leadership role around being able to see key components across testing, treatment, retention, and viral load suppression. We use a methodology called logic model design. It's similar to a theory of change, but really looks at what are our overall end goals and do we have the necessary information in terms of shorter term results, but also the activities and the inputs that are needed. So oftentimes these information are collected across different systems, spanning ELMIS systems, testing systems, community-based systems, and human resources systems. So in our support to different governments where we've been asked to support them to develop analytics, we aim to pull together the data across these systems to meet the overarching goals. And The approach is not building a maximum indicator set, rather it's really looking at what are our desired outcomes, health outcomes around the HIV cascade, and how can we prioritize and make sure that we're pulling the most essential data, because they have not typically had ready access to these data. Next slide. And as I mentioned here, working with the governments at the outset to really articulate a strategy to promote data use. I lead the capacity development component of teaching quality improvement skills to national and subnational stakeholders, to ask questions of their data, to set their own localized performance targets, and then to work together to find solutions. So that work is at the starting point, and often occurs simultaneously or concurrently as the investments in the information system strengthening startup and are ongoing. So there's a close collaboration between a data review committee and at the same time a task force working on information system strengthening. Next slide. And as I mentioned, governments are, of course, hungry to see their own data in real-time online dashboards. We do a lot of work around the analytics to view routine data. And what really drives this process and the prototyping and making sure that we're getting the right views is that we're initiating these data review conversations in the sala situacional, or the situation room setting, which is a mechanism that exists across all of the 4 countries. It's something that we have worked across existing structures to dynamize, to make more dynamic the methodology that they're using. And oftentimes we'll actually work with the data that they have as they're sorting out if it's interoperability between systems, if it's improving the way in which filters might work, but really striving to look at, interrogate, use the data while the development of the dashboards is ongoing. So we're in a hurry to make sure that we're using the data to achieve improved, for example, retention, linkage to care, and viral load transmission, and then that helps inform the work that we're doing simultaneously on the dashboards. Next slide. And I think this is my last slide because this is really our reason for doing this work. Here we have a great photo from Panama, working in a situation room with a group of subnational health leadership. They're looking at their data and they're asking questions and setting priorities for action for the coming month and quarter. And as I mentioned, we're really developing the capacity of the leadership to be critical in their review of the data and to think about how to address the root causes for sustained improvements. So on a regular basis, these groups tackle different challenges with their new access to the data and are able to document important wins. And so we call these, as Eric mentioned, data use cases that are developed by the government counterparts, and then they're able to share them with their peers for peer-to-peer learning. What are the visuals that they used? What were the methods that they used to resolve their challenges? And then what were the outcomes? So in this graph, I know it might be too small to see, but we're showing the results of some initiative taken to clean the HIV records and to get a better sense of HIV retention rates. And then that in turn informed how the health system worked through the health facilities and the community to find those who had been lost to care. So as we work through data use priorities, at the same time, we are strengthening those systems that provide the data, aiming to make that system stronger and more resilient. And with that, I'd like to turn over to my colleague, Otto. Please, Otto, over to you.
Thank you, Jenny. Thank you, Eric. Hello, everyone. My name is Otto Letona. I'm the Health Information System Senior Advisor for the Central America region. I'm really glad to be here today. And following the previous presentation, I will share with you the Health Information System process. Next slide, please, Eric. Okay, our first step is to map the system landscape. As Eric told us at the beginning of the presentation, everything starts with the definition of the priority indicators. Okay, so what we start doing here is to map the systems landscape. What systems are in the last games? These systems are responding to what different scenarios or what different necessities, who are the responsible for each one of these systems. So the first step is to understand all the systems involved in this, in the construction of the prioritized indicators. So in this example, this is example of one of the countries that we are working on. We are mapping here the different systems in which, in what pillar are they working on? What is the responsibility for the system to capture this information? And with that, we start to understand the data source that we will need to use in the construction of the key indicator. That is our first step. Next, please, Eric. Thank you. The second step of following the first step of the system landscape, we start understanding how each one of these systems is working to mapping the information sources from the different stakeholders. As you know, or you could see in this slide, each one of them are using different technologies, are using different ways of communicating the information with the national programs. And our work is to map all that different technologies, all the different process that they are doing, and to understand the different source of information that we need to manage, to bring all that information together, harmonize it, and to align that information to be used in the dashboard that Jenny showed us in their presentation. So the second part is to make a deep dive to understand how is working each one of the system and what are the data source that we will use for the indicators construction. Next slide, please, Eric. Following that process, we need to understand, the first step was to define what we want to see, the indicator. The second one was to identify the different systems that are related. And now we are trying to understand the operational requirements. So we have some ideal flows of information. That is our goal, how to understand the ideal process to have in the different countries. And what we start doing here is to understand what processes are involved in the construction of the indicators or in the gathering of the information that we will use to build the indicators. So here we start talking about process, not just system. Now we start talking about process. And in the next slide, please, Eric. This is an example. Okay, we know that we need to map the process that currently are gathering some information to build the indicators. Okay, now this is an example of a list of workflows what we need to build, because we identify that these workflows are key in the construction of the indicators. Also, we map the key contacts or the person responsible to execute the process, or the person that have the knowledge to execute the process. And we make interviews with each one of them just to understand the current process. How are the different parts of the ministry working today? How are they gathering this information? What system are they using? What other actors are involved in this entire process? Always trying to have this holistic view of the solution. After have these interviews with the key actors, we start mapping what we call the current process, and we show them after the interviews in a separate workshop the result of this interview. In the next slide, we could see an example of a process that came as a result of the interviews. Now, in this workshop, we start talking with the key actors and show to them this slide, and start asking them for feedback. Is this workflow okay? Are we missing something? Is there something different? We need to adapt something in this workshop to reflect the current reality. And of course, we receive that feedback. In this example, you could see some red letters in the comments to register the feedback that we are receiving from the key stakeholders that are the persons who know exactly how are they doing the things in the day-to-day activities. So we build this workflow, we receive the feedback, we adjust the workflows, and after that, we have some analysis, having the current workflows, having the ideal workflows, having the landscape system mapped. So after gather all that information together, we start with the next step. Please, Eric. Okay, so after have all this information, I've mapped the gaps between the current situation workflows and the ideal situation workflows, understanding the system landscape currently on the country. We start doing some health information system recommendation and implementation support. This is an example. We deliver to the ministry an analysis of workflows and information management systems and build some recommendations for improve and a proposed action plan and priority list. So what we are looking here is to say, okay, after all these diagnoses, we have some recommendation to improve the processes, to improve the systems, and to a proposed path to follow to implement the recommendations. Okay, some examples of implementation support will include create or improve process documentation and train health workers, harmonize data collection tools, some service points, integrate existing data source. It's a lot of possible things that we are recommending here in these documents. And of course, all of this in the support of the prioritized indicators. Everything moves around the prioritized indicators. Next one, please, Eric. Some results and highlights from the health information system strengthening process. In Guatemala, we facilitated data sharing agreements, led technical discussion to harmonize metadata and align management procedures, implement a repository to integrate HIV records from the National Social Security information from the Ministry of Health and 10 implementing partners, including 3 funded by USA. Aggregation of data to analyze priority indicator was decreased down from 45 days to only 5 days. So this is a big example to harmonize and to align many actors to have all the information together and to give that information in a certain way, in a clear way, to be used in the data strategy, in the data use strategy that Jenny mentioned before. In San Pedro Sula region of Honduras, only 30% of the patients were linked to care. By February 2023, 90% of the patients had either been linked to care or returned to care as a result of the data cleaning efforts. Similar in Panama, the rate of linked patients increased from 65 to 77 by July 23 at Santo Tomas Hospital, that is the largest treatment care center in the country. We no longer view data passively. with Data.FI support, we jump into action in the field and are improving outcomes from our HIV positive population. This is a comment or a feedback that Doctora Alma Braona, regional epidemiologist from San Pedro Sula, Honduras, gave to us. Next slide, please, Eric. And moving beyond HIV, our methodology, all the methodology from the definition of the key indicators, all the process of the data use strategy and the health information system strengthening is adaptable. And we are working in Guatemala with other different topics or with different topics as a request of USAID Regional Office. Yes, we are working now with neonatal care, National Directorate Care Programs, Food and Nutrition Security Program, with regional partners, is the Middleware Initiative, and we are just starting with Global Health Security. This is all the new topics that we are working on here in Guatemala, and based on the experience in HIV in other countries. Finally, the Data.FI Central America organization, this is just to share with you that this is a team involved in this is all the team that is making this happen. We are aligning all the team with two main ideas. First, to have a regional alignment, to have to find some synergies across the region about how things are working in other countries and how can we use that experiences in other countries and other topics. So our regional leadership team is leader. We have a regional technical director, Eduardo Samayoa, for Guatemala, Salvador, and Honduras, and Licien Valladares, our country director in Honduras. The regional technical team, the Health Information System Advisor, the Data Use Advisor, and the MEL Manager. We are working across the region, and we have some resources in the countries. They are key. They are the ones that have the detailed information and knowledge in our countries, and they are the ones that make the things happen. At the left of the slide, we have all the support that we receive from headquarters or leadership team and our regional advisor that help us in all the process. So it's just to show you that all the work that we presented before are made by an incredible team that is working across our region. With that, thank you everyone. Over to you, Eric.
Thank you, Otto, and thank you, Jenny, for this comprehensive review of the work that we are doing in the region. We have seen how the work in the areas of health information strengthening can be combined with the data use practice to improve health outcomes. By way of discussion, I would like us to share a few takeaways. The first one, as I mentioned at the beginning, the Data.FI project, our goal is to help countries improve health outcomes. And in order to deliver on that promise, on that mission, we need to be clear about what it is that we are improving. So we need to have that conversation with the stakeholders and alignment on what needs to be improved and how we're going to measure it and why that's important before we move into the how, what is the intervention, what is the technology, or what are the processes that need to be improved. So that's number one. Number two, something that if you are in the health information strengthening practice or the digital health practice, you know that there's a lot of talk about improving the enabling environment, being able to make sure that the necessary building blocks are in place so that digital health can grow. And this includes people, processes, regulations, and technology. So it is important for us to not lose sight of that. And as we have shown today, that is part of what we are doing in the Central American region. And thirdly, as you saw through my colleague's presentation, this work is participatory. We are working with implementing partners, with different donors, with local health authorities. This work is not, we cannot attribute it to us alone. There's a lot of people involved in it, and our work is to facilitate those conversations and help improve the work that everyone is doing. And so in doing that, we believe that we are strengthening local authorities, building capacity, and being part of the promise of localizing all these interventions and making sure that we are addressing barriers to HIS development in country. In closing, I would like to leave you with some reflections. As you saw in this presentation, the process that we have followed, we begin by examining the available literature, meaning what is the international guidance says about HIV programming. Our colleague Jenny Mwanza referred to the United Nations AIDS Agency guidance and also WHO guidance. Our colleague Otto also referred to the guidance from WHO in regards to the exemplar or ideal workflows for HIV. So there's a lot of information already out there. And so my reflection to share with you is how can we ensure that our projects include a revision of that available guidance and also define clear priorities or health indicators so that we have a clear goal in mind in these interventions. Number two, as we discussed, improving the enabling environment. This is a multidisciplinary effort, and the end goal is to increase participation and ownership. How can we make sure that this is part of the HIS practice as a whole? As practitioners, we believe that this is important to always keep in mind and to have it become part of our regular practice. And lastly, just in general, from what we have shared with you, we would like to hear your thoughts and comments on how this can be applied in your countries and what are the barriers and opportunities you see. And with that, we thank you for your time and participation. We hope that this has been interesting and will be useful to you. And we hand it over to our colleague Lawrence to facilitate questions and discussion. Thank you.
Thank you, Eric. And thank you once again, Otto and Jenny as well as to everyone for listening in. Eric, just as a reminder, your camera is still on. So Eric, happy you're excited the presentation's over. Anyway, yes, so thank you everyone for participating. And then now I guess we just turn it over to Q&A. I already saw we had one excellent question in the chat, and I thought maybe we could just start with that. But if anyone again wants to type more questions, or maybe you have a specific question to direct it to one of the speakers on any of the topics we covered today, just feel free to use the raise hand function, unmute, or as I said, type in your question. So Eric, Jenny, Otto, I don't know which one of you, or maybe all three of you want to briefly touch on this question from Betty Atai on, I would just like to get a sense of how long does this entire process take in terms of supporting a national system, and which step is the most consuming and difficult? I think that's just a really good question to get a sense of, again, the difficulty involved in this process. So Eric, Jenny, whichever one of you wants to go first, please.
I think I'll step in and say that I can provide some framing, but I think Eric and Otto have a better sense of the information system strengthening piece. I think that as PEPFAR's digital partner, we are interested in having quick results around improving and strengthening information systems. And I think what we've really learned in Latin America is the importance of getting the program managers, the national HIV program, those responsible for testing and labs, getting everyone together and really jumpstarting this conversation about what are our priorities, what is the data that we need, and oftentimes we really begin in informal conversations while the larger conversation about the information system strengthening is ongoing. So we are not waiting. There's lots of work to be done. There are lots of individuals who have been lost to care that need to be found and re-enrolled. And all of that work happens and really informs what are the priorities that we need to make in the information systems. So I'll pause there, and Eric, if you want to talk more about the actual timelines, but in many countries, we continue to work with the data that we have available.
Yes, I agree. I think that's exactly what it is. I think it is important to note that each country has a different reality. So we have countries that have a centralized information system with large databases. In other countries, it's just Excel spreadsheets that are used at the facility level and at the regional level. Nonetheless, it is the same approach. You know, it's sitting with the partners, sitting with the local authorities, understanding the data, trying to build governance around how data is managed. Even if it's just Excel, there's ways to reach agreements on what are the formats, the standards, the flows for that information to be used. And the presentation Jenny shared in her last slide, a picture of the Panamanian case. That is a very good example. It's a very low tech environment, no internet, no electricity. That picture was taken in a remote island with generators and everything. So we're doing data use, even though it's very low tech. Still, everything is manual, and we are doing everything we can to improve their systems. But yeah, it's different in each country. But to answer the question itself, I think Jenny can correct me if I'm wrong, but I think the goal is to have results within a few months, maybe 3 months, be able to produce a data use brief. So whatever the intervention looks like based on the conditions on the ground, the goal is to see results through the data use review committees, the situation rooms, and to show progress as soon as possible. And yes, ongoing discussions with how the systems and the information can be improved. That's for the long run. A lot of the recommendations that we give, we try to support, but obviously it's not in our hands to do everything at the end of the day. Over.
Otto, did you have anything you wanted to add about maybe the health information system side of things, about how long it takes from the start to the end of the process you were describing?
Thank you, Loris. I think Jenny and Eric explained very well almost all the process, but just to talk about the health information system, answering the question, I think the time lapse depends on the interaction with the different stakeholders. We, as Eric mentioned it before, we work together with the government, with different agendas, with another implementing partners. So maybe the entire process depends on how open are their agendas. And the second one is the most difficult, and not a difficult process, but maybe the most challenging process is to get an alignment, to focus all the participants in the same way and have all an agreement about what are our key priorities to work on. Is, I think, the process that requires more time and discussions. Over. Thank you.
Excellent. No, that's a great detail. We received another great question from Anna Kushir. I won't read the whole question, but she mentions in the Argentinian context the importance of health transformation issues in the parliamentary agenda. And so she wanted to know, do we work with parliamentarians in the countries you mentioned to improve digital health-related national legislation? Is that an aspect you consider? We, that is Anna, frequently work supporting innovative legislative initiatives, but not yet in Central America. So Eric, and then maybe Otto and Jenny, do you want to touch on the legislative or working with government on that side of things?
Yep, I can give it a try. Yeah, I think we definitely can. And the work that we do, we are already working with health officials, and these are the same people that are sitting at the table when the legislations are being drafted. So we are definitely supporting those efforts. In Guatemala, we know there's a digital health strategy that is underway, so and we are part of that effort as well. And more broadly, beyond the digital health strategy, there's also other very salient topics like information security. Some countries that have an information security law, that personal data protection law that is very relevant for information security, especially in health, and even more relevant for HIV programming. So we work with governments to ensure that the work that we do is in alignment with those regulations. And if those regulations are not in place yet, we help them find ways to design minimal controls and implement best practices to ensure the information is protected. So yeah, certainly we can work with that.
Excellent. Otto, Jenny, feel free. Any other thoughts on that? Nope. Okay. Great question, though. I really, obviously legislation and working directly with governments is an important part of this work. Another great question about zoonotic diseases. So do we have any experience working with animal health in other countries? Maybe tied to the work related to what we're doing with agricultural ministries. Jenny, do you maybe want to touch on this? Or Otto?
I actually would like to defer to our regional manager, David Merchant. If you'd like to go ahead, are you able to unmute?
That's true. David, are you in the call? And if so, could you just go ahead and yes, please go ahead, David.
Thank you, Lawrence. Jenny, thank you very much for highlighting this important question. So as a USAID-funded mechanism, we're also receiving, we're a mechanism able to receive global health security funds. And we have recently been allocated funds for Tanzania and Guatemala, where we are going to be promoting the One Health, or we're going to be working rather, under the One Health approach. Meaning all human, animal, and environmental health would be taken into account to support governments to prepare for future pandemics or future public health threats. So under that scope of work, specifically in Guatemala, we're going to be, one of our ultimate goals is to design a dashboard that can support emergency operations centers with adequate information and that pertain all the three domains of the One Health approach. And what we want to do is follow the same methodology that my colleagues described during today's webinar. We're going to initiate with a prototype of a dashboard. We're going to define a logic framework or a logic model with prioritized indicators. Naturally, we want to engage the relevant stakeholders from the Ministry of Agriculture, the Ministry of Health, and the Ministry of the Environment, and coordinate with other relevant stakeholders that are also contributing to the One Health approach. And finally, highlight the expertise from multiple individuals and partners that are working towards common goals. And on a related note, there is a question from Molly Cannon on the chat on other non-HIV areas of work. I will defer to my colleagues because they have a lot of expertise on health, nutrition, etc. But this is another area, GHS, where we're going to be working. Back to you guys.
Thank you, David. That was great. Jenny, go ahead.
Yeah, and I just wanted to share that, I think the overall approach around starting with our data use needs is really important when we're looking at the One Health sphere and the intersection, because we know that human health, Ministry of Health surveillance systems are much more developed oftentimes than those that we C for animal health or zoonotic diseases. And so if we can put the coordinated response when there is a suspected event out in front, so how will those officials work together? Then we can really support prioritization of what are the most important indicators that everyone needs access to most quickly. So, really trying to shift about how is our support for data systems really prioritizing quick and swift action so that we can be more agile in our response as we face future outbreaks and future public health events. And then look at what are the implications for the information systems. So a lot of times we're asked, can we interoperate systems? And we have excellent technical teams that can do that type of work, but really getting out in front of what is the type of information that we most need most quickly to make the best decision. And it's not always about merging two systems together in their entirety. It's about it's about looking at what is that key indicator that motivates. We need to investigate, we need to notify, we need to respond. So, really thankful for this opportunity, both in Guatemala and Tanzania, and know that there are other opportunities and others are facing these same challenges. So a great topic of interest to us as well.
Thank you so much, Jenny, for that extra detail. And yeah, we could have a whole other webinar now on the subject. I think we're just almost at time. So I think one last question, and it's kind of, David already touched on it a little bit. But Eric, I thought maybe you would want to address the global health, if there's anything else on global health security in the region, maybe also outside of Guatemala that you wanted to address. Or maybe you can just speak about addressing what Molly's question was, other non-HIV areas that you feel like we haven't really addressed yet in the Q&A.
And Otto, could you speak to that in Guatemala, our work around primary health care and maternal health?
Yes.
Sure. Thank you, Jenny. No, just to talk about another topics in Guatemala and in Central America, we are working on nutrition with the PROSAN. We are working on neonatal information. We are working with GHS, as mentioned David before. We are just starting this conversation about GHS. We are working too with HIV, with the quality of service measurement in the services in the entire region. We are working with different topics, always with the health ministry in Guatemala. So yes, we are having a big scope right now.
Eric, was there anything else you wanted to add?
No, just to reiterate the fact that ultimately we want to build capacity in countries. So this methodology in the countries where we work, the health officials become owners of this practice, and I see them moving towards other areas of health programming for other non-HIV health programs, and that's the case in Honduras, where we see it being used right now for dengue. And yeah, so it's not something that we are actively engaged anymore, but we see it carrying it forward and taking a life as its own. Over.
Amazing, thank you. So we're at time now, so just to respect everyone's schedules, again, I just want to reiterate to everyone who's still with us, thank you so much for joining us today for this discussion and for all the great questions. And I have put contact information for myself, for Eric, and for our Senior Regional Manager, David, in the chat in case there was any further question you felt wasn't answered, or you have a thought that hits you 3 hours from now and you want to reach out. We really welcome it. And we will also be sending this recording to everyone who was joining us today or people who might have popped out early. So, you'll be able to catch the whole conversation. And yeah, with no further ado, thank you again so much to our speakers and to all of our attendees. And I wish you all have a great rest of your day. And yeah, thank you very much.
Thank you.
Thank you all.
Bye, everyone. Thank you so much. Bye-bye.